Good evening, everyone. Am I visible and audible to each and every one of you? Am I visible and audible? All right. So I would request you all first one thing that you will be replying me on YouTube instead of this WhatsApp group. I'm opening YouTube. Yes, that's good. I can see your messages on YouTube and we would be chatting here because in the subsequent classes, in the next classes, you will be provided with that software and all where you will be chatting with the faculty on in your laptop or mobile like this only. So hi everyone, good evening. Welcome to the first day, inaugural day of the fifth batch of our ultra successful program, which is of final year BDS. Guys, when we started, I myself, I'll talk about myself only. I thought like it has been 15 years since I did my BDS. So while I was in final year, I always used to think like I just study through the book. There is no one in classes, no one teaches us, right? I did my UG from Dr. Ziauddin Ahmad Dental College, Aligarh Muslim University. So no one used to bother to teach us. Like even if there is a doubt, we had to wait for the professor to come out of their chambers and listen to us, or they are talking to someone on the phone or amongst themselves. Okay. Although my college was very good, there was a lot of flow of patience. But what I lacked there was like if I have a doubt, I only have my seniors. I have to rely on my seniors only. But there is no like trained faculty and expert. And I did not know what I was lacking then. But now when I interact with you, I have been interacting with you people for now 4 or 5 batches. And the feedback that I get through the students, through previous students, now I know why this is very, very important. So on this time, right now, I would like you to build a relationship with me and rest of your faculties that in your classes you all will be present and you all will interact, you all will respond, and you all will ask whenever you have a doubt, you have a query. You have to be blunt with your faculty, with me. Whenever there is a doubt, you will ask. All right, that is the most important thing about these sessions, these lectures, because you will realize how important they are once they are done, once you are through with your final year. Okay, because this feedback we get from previous year students, previous batch students, that yes sir, your lectures were really good help in our viva. We were skeptical about how will we go about it. We were very terrified, but whatever you told, the examiners asked me this way, are they your friends? Few of them asked like this also, sir, that examiner, is he your friend? Because the questions that you told, exactly they were asked. Okay, and it's not just about me, rest of the faculty is also. So again, good evening everyone, and I just I do not know how many of you are attending this lecture live. So I want a heads up. I want a thumbs up, a smiley, any emoticon. I know when you people are much more tech savvy than me. So please on your WhatsApp, this YouTube, you please respond like how many of you are here. Once I get that, then I'll get to know how many of you are here, how excited you are, how ready, how charged up you are. And then we will begin our session. And since it's the first day, I want to have keep it light, keep it cool, so that we understand what the coming weeks will be all about, how we will approach the syllabus, because each subject is different. Perio is different from oral medicine, which will be different from prosthodontics, from orthodontics. All right. So everything is different. And books, right? Which book to follow? That question I get from each every one of you. Good, good, good. Hi, I like this. HY. I used to think hi is HI, but yes, HY, new thing to learn. Guys, which book you follow for periodontics? That is a very, very important question. That is a basic foundation question. Okay, which book you follow? That you need to tell to me. Kerenza, right? 10th edition, good. I like this sort of answer when you tell everything. But now there is 11th also. You can always go for the 11th edition also, when that again is very good. Yes, good. Please, guys, do not follow any guide sort of book. Okay, any author which cannot be credited with the actual work. Okay, here I won't be taking any names, but Kerenza is the Bible of periodontics. There is a book called Linde also, right? But that whatever is important from Linde, that again is a very good book. Online it is available. You can have the PDF, but that is once you go and do your PG in periodontics. That books becomes important then. Right now, beyond Carenza, you do not need to go anywhere. Okay, and make it a habit. Study, make your notes, and whenever you are in your OPDs with your patients, try to apply that knowledge that you studied through your book. Okay, and Carenza third South Asia edition. Okay, try it to do that from 10th and 11th. And nowadays you all would be having book in your PDF format on your mobiles, also on your tablets, iPads. Okay, so that also is a good thing to have, because at times you recall something, some doubt, and then you do not have to wait to get to your room or library or your college. On your mobile you can open up your book. So, and these days your mobiles have a lot of memories. So I would request, like, if you can have uh, soft copies of each and every book in your mobile, try to have that also. That works really well. At times you need your books in your mobile. Okay, so guys, first let's start interacting. You tell me, what do you expect from these sessions, from perio sessions especially? Okay, because I'll talk about perio only. What do you expect? What do you want to learn? Which way you want to learn? And in your colleges, like, I do not know each one of you, how many months you have been through with your final year. So what difficulties do you face in periodontics while you are studying, or what difficulties do you face while you are in your perio OPD? I do not know how many of you have done the perio OPD. You have your posting in periodontics department, but these sessions will not be only about theoretical knowledge. I want you all to become good periodontists. Okay, that has always been my goal, because we all are doctors at the end of the day. Just clearing the exam is not our goal. Yes, that is our immediate goal. I'll help you with all my might in that respect. I do not want to memorize periodontics. That is a very, very good point. You should not memorize any subject. You must understand every subject, every topic, every technique, every theory. And when you are asked about it in the exam, in your theory exam, you can write in your own words. Good, I will help you with that. Clinical correlation, that again is a very very good point, and that's what I was talking about, that yes, we will, clinical correlation, very important. Okay, so we will do it. And now in periodontics or in every any other subject, there are few chapters which will make your base for clinical topics. All right, you first have knowledge about the subject. By subject, I do not just mean the theoretical part, how you will apply that knowledge when you're working on the patient. Because you see, now after 10 12 years of my practice, I do private practice in Agra. I'm based in Agra, in the city of Taj Mahal. Okay, I did my UG from Aligarh Muslim University, and then I did my PG from Government Dental College, Chennai. Both are good colleges. Okay, so now when I treat patients in my own clinic or whenever I go for consultation, I know as soon as patient tells me the chief complaint, that how will his or her oral cavity will look like. And this is what I want you people to feel. Like whenever someone says, a patient says, I have bad breath in my mouth or my gums bleed while brushing, so you must have a picture of how his gingiva would be looking like. Okay, what all you will be doing. Next question is, sir, also I want conceptual clarity for the subject so that I can have a strong foundation. All right, we will have conceptual, right? Visualization of periodontium. Visualization of periodontium is something like, I will post pictures wherever required. I will keep on posting pictures from Carenza, from other sources, clinical pictures. And while I treat patients at my clinic also, no, what I do, like, there was once a patient who was having only that materia alba, and I recorded a video, and there was a patient with bleeding on probing. I treated, and 15 days later there was no bleeding and probing. So that pre and post video also I have. So once we are on that chapter, I will discuss, and that will help you a lot in understanding. So whenever things are like, that's what I said, you have to be very frank with me, very open with me. In you must not hesitate, right, in asking, sir, we want this, can you show us this image, right? So all those things you people have to ask, because I will be telling you, I will be teaching you from my point of view. I know what all is asked in the exams, in the written exam, in the Viva, that I know. But that only is not important. Apart from that, what is important is each and every one of you, how do you see periodontics? Because every individual is different. The way you understand whatever I'm teaching will be different for each one of you. I hope you are understanding what I'm trying to say. So it's not like every one of you will have the same problem. You will have the similar doubt, right? One topic could be very easy for someone, while it will be very difficult for other one. Okay, so when I ask you, did you get this point, and 10 people say yes sir, we understood, the 11th and the 12th, if you have not understood, you must not feel hesitant to ask me. Okay, because if you don't say that sir, we didn't understand, how would I know that you haven't understood? Okay, so that is very very important. You have to be open with, because that time will not come back. The chapter that we do today, in the next class, in the subsequent class, we cannot come back to that. That moment is lost, that flow is lost. Okay, so now I'm asking you, are we done with this like chit chat? It is important. I want to have a relationship with you, because for the next few months, every Monday, we people will be meeting each other. So do you want to ask anything, or you want me to jump to anatomy of periodontium, the first chapter, the very important chapter? Every year a question is asked from this chapter. You people have to tell, but all what I can see is just 4 or 5 of you have replied in this. Okay, so let's see. Either not everyone is open to messaging. Shall we start, or you want to listen to a few college stories also? In OPDs, in classes like in periodontics, it's not a people used to say it's a boring subject, but I assure you it's not a boring subject. It's a very interesting subject. It's an easy subject, like your operative dentistry and endodontics. You have to do 2-3 books. Prosthodontics, 2-3 books. Schaefer's and all, they all are very heavy subjects. Periodontics is an easy subject. Yes sir, you can start, which means now you people are getting bored with all this, right? In a way you are saying, sir, now we are bored, you start with the real work. So guys, every chapter you have, I mean, you just do not have to study hard, you have to study smart. Okay, you have to manage your time. Yeah, I'm starting and I know what you people meant. Okay, and since the first class, we'll keep it light, right? What I was telling is, you people would be having the previous year questions, okay, in your university. If someone of you does not have the exam papers of your university, you please take from your seniors, okay, or they must be available on the website, university's website. They will be there for sure. You can take from other universities websites also, so that you have an idea what questions are asked. Okay, now the questions are like, there are LAQs. If you people do not understand my handwriting, please be blunt about it. You ask me to write again. There are short answer questions and there are very short answer questions, right? There are LAQs, SAQs, and very short answer questions. There are now even MCQs are also asked in university exam, but they are very few, 4-5 marks they carry, but they are important because I feel and I hope and I want each one of you to go for NEET entrance. Once you are done with your BDS, once you are a doctor, just don't get settled there. You aim for MDS, because once you crack NEET, you are like something else. Okay, so I hope all of you are thinking in that direction also, because this foundation class is a stepping stone for your NEET preparation. Wherever I feel like that is important, I will tell you. Okay, so I hope each one of you is also preparing, I mean, want to prepare for NEET exam, right? If there is someone who wants, yes, I will be giving NEET exam 1 year later, you tell me in the comment box, so that I can get to know that yes, these people, they want to prepare for NEET when it comes. Okay, now coming back to this, there are few chapters from which long answer questions will be asked for sure. There are few chapters from which only short answer questions or very short answer questions will be asked. Okay, so you have to be sure about it. Now this chapter, anatomy of the periodontium, it is an important chapter for long answer questions. This yes sir is like, you can type some anything else also, like for what you said yes sir. I have that Gajani problem. This is a short-term memory loss. I forget what I asked you. Okay, so what this yes sir is for, I do not know. I hope you all have seen that movie, Gajani, Amir Khan's movie. Okay, so coming back to this long answer, this chapter is very, very important, anatomy of periodontium, and it is the basic chapter, the basics of periodontics. You must know what is periodontium. Okay, now starting with this, periodontium. What is periodontium? Peri means around. Okay, dontium means tooth. So the structures around teeth. NEET PG exam. Great. That's the spirit. Alright. So the structures around teeth, they all include the periodontium. In this come gingiva, periodontal ligament, sir, start. I have started. Okay, so you are the one who is most irritated with my non-productive talks, which will not help you at all. Right? Okay. Periodontal ligament, cementum, and alveolar bone. Okay. So these are the four structures which constitute periodontium. This is like ABCD of periodontics. Okay. When you give your viva, when you are sitting in your viva, in your that grand viva, there are few questions which examiner asks you to clear you in the exam. Okay, I mean, on the basis he decides whether you are worthy to be promoted or to become a doctor or not. So if he asks you what are the structures that constitute periodontium, and if unfortunately you are unable to tell that there are four structures, gingiva, PDL, cementum, and alveolar bone, and they together constitute the periodontium, no matter you tell the most difficult of questions, he will have a doubt about clearing you in the exam. Okay, because this is not something which can be said like you panicked in the exam hall, you forgot, you were tensed, you were stressed. This is like asking a fourth standard student what is, I mean, A for apple or B for ball. It is like that. Okay, this is as basic as it can get in periodontics. Or like in your what example should I give? In other subjects also there will be something. So this is the most basic thing about periodontics. So now guys, these four structures we will be studying separately in this chapter. This is a big chapter. Okay, and in this the questions, long questions can be asked on each and every topic. Okay, on gingiva, on PDL, on cementum, and on alveolar bone also. Right? So gingiva is the first thing, the first structure on which questions will be asked. Right? About gingiva, can you tell, I'm asking you people, what questions, any one of you, can you tell me like what questions have been asked about gingiva? Because this way I'll get to know whether you are there, someone of you, any one of you has done some homework about it or not. Any one of you. On gingiva, any question that you can tell me? Parts of gingiva, yes. Definition, macro features of gingiva, micro features of gingiva. Very, very important question. Clinical features of gingiva, clinical features of a normal gingiva versus gingivitis. Good. Hey, this batch is good. You people are good. You rock. Clinical features, histological features. Yes. So we are going to have fun, I'm sure. This is a good batch. I mean, the batch keeps on improving every year. All right. Yes, all these questions are asked. Okay. So gingiva, what does gingiva do? Gingiva covers LAQ and anatomy of gingiva, histology of gingival structures. Yes, good. PDL LAQ. Yes, and right now we are talking about gingiva. First, the gingiva. This is long. Okay. So gingiva, it covers alveolar bone and tooth roots just coronal to CEJ. Okay. So gingiva is that part of the periodontium. These lines are from Kerenza. There are things when you are writing an answer, things which you will write in your own words. Like someone had said you that he does not want to memorize periodontics, which is the right way to go. Okay, but there are some things like definitions or which are standard text. Okay, so wherever there is a standard text, that I will be telling you. Okay, so gingiva covers the bone and the root to a level which is just coronal to the CEJ. What is CEJ? Like this is crown and this is the root. So this part is the CEJ, right? CEJ. Okay. What does it mean? The portion of the tooth above the CEJ, we call it crown or anatomic crown. Okay. And the portion which is below CEJ, we call it anatomic root. Okay. Now with recession, at times what can happen, like gingiva covers at this level, right? Gingiva covers at this level. Okay, just coronal to the CEJ. When there is recession, gingiva shifts below the CEJ. So clinically, what is a crown? Crown is that portion which is visible in the oral cavity, which is above the gingiva. That is clinical crown. Okay, but when there is recession, when the crown goes below gingiva, like I draw it again, this is crown and this is the gingiva right now here. Okay, and this I'm drawing again the same tooth, but here gingiva has gone down like this. All right, this is the thing. So in this portion is the crown because this is above the gingiva, right? This is the anatomic crown as well as the clinical crown in the healthy gingiva. But here the gingiva is here, so till this portion below the CEJ also, this will be the crown, but this is the clinical crown. Okay, so that is the difference between what is anatomic crown and what is clinical crown. Anatomic crown, which is coronal to the CEJ, that is anatomic crown. And the part of the tooth which is visible in the oral cavity, that is the clinical crown. So I hope you people understand the importance of gingiva. The root should be covered with gingiva. Why? Because root is not covered with enamel, it is covered with cementum. Okay, it has cementum, and root, if the gingiva gets receded, okay, it becomes sensitive, it becomes prone to get caries. So that is the importance of gingiva. It's basically a defensive structure, it is a protective structure. Did you understand the difference? Whenever I ask you, like, it is clear to you, if you people do not reply, I cannot move forward because that is important for me. Is this clear or not to you? Please, everyone, reply on YouTube only. Okay, please, I saw one reply on you people. Please reply on this YouTube comment section. There are structural variations. Anatomically, this gingiva, okay, it is divided into marginal gingiva, attached gingiva. Okay, just give me a moment. I'm getting one call again. Just give me a moment. Okay, people, am I visible and audible? Am I visible and audible? Great. Okay. So we were on anatomically, gingiva is divided into. That's the first question that is asked, right? About anatomical different, and never get confused because there will be a structural differentiation also, right? Now, what is the need for anatomic differentiation? This question can be asked in the viva. Why does gingiva gets anatomically distributed, right? So that is the anatomic differentiation. Why there is this anatomic differentiation? All this is function based. So this is for protection against microbes and mechanical damage. Okay, are you able to understand my handwriting? Is it clear to each one of you? Right now, the first part of the gingiva is marginal gingiva. You can have a very short answer question separately on marginal gingiva as well. The beauty of preparing a long answer question is you are preparing 3-4 short and very short answer questions also. Okay, so in last year in one of the universities, a 3-mark question was asked on marginal gingiva also. Describe marginal gingiva. This was the question, a 3-mark question. Now, people, you have to be smart. In a 3-mark question, at max, you will get 3. And most of the time, examiners give, if they found the answer perfect, 2.5 marks. Okay. So, 3-mark question, you just have to fill 1 and at max 1.5 or 2 pages. All right. So, do not go on write 3-4 pages. It may be possible that you know a lot about a certain topic which has been asked, but the weightage of that question is very, very important. Okay. If it is a 10-mark question, 12-mark question, then you need to fill pages. But if it is a 3-mark, 4-mark, 5-mark question, you have to be smart about it. Because in a 5-mark question, you cannot get 10 marks, right? Even if you draw beautiful diagrams, beautiful illustration, everything, okay, you can get at max 5. So in order to write a 5-mark question very well, you may lose on some time that you could have spent in writing a 10-mark question. Okay, and always try to finish the long answer questions first. That is the way to go about your exam. Okay, like, because if it's a 3-hour question exam and the long question constitutes half of it, so in half of the time you must have done them, so that you are at least in that passing zone of clearing the exam. All right. So all these, I mean, you guys in the final year, which means you would have cleared first, second, third year. But like for us, it is like we just want to tell whatever we know and what like I suffered in my second year BDS exam. Okay. Do you want to know about this, or should I come? Because this is my personal experience that I'll share with you. If you people say yes, tell. And the meanwhile, I'll have one sip of tea also. What happened with me in second year BDS? There was exam of dental histology. Okay. And generally that Orbans is the book, no, of the histology. They usually ask about anatomy of a tooth. Okay. And mostly it is a molar, right? But I was, that year they asked premolar, maxillary first premolar, and it was a long answer question, right? It was a 10-mark question, and I guess the exam paper of it was of 70 marks. If I'm not wrong, it was in AMU, Aligarh Muslim University. They used to a 70-mark paper. Now, that was a 10-mark question. I have not studied a single word on the anatomy of maxillary first premolar. All right. So what I decided, like, this question I do not know, I will do it in the last. Okay. Because I have to now think and ask my friends who are sitting around me, like, bata dena yaar, maxillary first premolar ki anatomy kya hai? Even I asked one of my friends and he said, let me write first, I'll tell you in the end. Okay. Now, either I have to rely, I should stop. So what I decided, I will do rest of the questions. And then I will go with anatomy of periodontium. Oh, sorry. Anatomy of maxillary first premolar. So I wrote all the questions and 20 minutes were remaining. And I was still having a 10-mark question. Okay. I have done very well. Of 60 out of 70, I have done. But I still have a 10-mark question. But I do not know anything about it. Just 20 minutes remaining. Now I'm panicking. I kept on asking my friends again and again, but they were also writing. I was mad at them. I was mad at them after the exam also, but now I understand they were not wrong. Okay. So what I did, for a 10-mark question, I wrote only 2 pages about maxillary first premolar. I do not know what I wrote. It was all trash. I did not know anything about maxillary first premolar's anatomy. I just got passing marks in that dental histology exams. Okay. In my rest of the papers in second year, what all, the physiology, I guess, no, that is in first year. Second year, I have microbiology is in second year, I guess. Okay. So in rest of the subjects, I got good marks. But in dental histology, I just got passing marks. So once I was promoted to the third year, and I was discussing, once I met that teacher of dental histology who used to teach us, I asked, ma'am, I just got passing marks in dental histology, and in rest I got good. I don't know why. Ma'am told me that happened because in a 10-mark question, you wrote just 2 or 3 pages. It was clear to me while checking your answer sheet that you do not know the answer. But you are not the only one. You are not the first one. There are people who do not know the answer. But when a question comes and it is a long answer question and you do not know, but you must be knowing at least some basics. So, right, attempt a long answer question first. Okay, because we as examiner also have gone through the same thing. We understand, we know, but what we want to see is your effort. Okay, whether you are applying your effort or not, and that's what counts. In your case, it was evident that you kept that answer for the last. Okay, you must, even if you keep it for last, but you start, at least you try, you attempt. Okay, so that is important. I mean, that was my formula. You all people will have your own way of approaching your exam, but what I'm telling you, what is the crux of this whole story is, if the question carries weightage, more weightage, you have to give it respect. You can do it in the last, but you must be confident that you have managed your time properly, right? Because once, like, there are questions which you know the answer about, and your pen will be in the flow. Okay, in 10 minutes you can write 4 pages, but when you do not know the answer, then 10 minutes are less for writing even 1 page. Okay, so I hope you people got the point that I was trying to tell through this. Now, coming back to the marginal gingiva, this is the diagram which you will draw whenever there is a question on gingiva. Okay, either it's marginal gingiva, attached gingiva, uh, clinical features of gingiva, anywhere you can utilize this. Diagrams are very, very important. You draw a diagram, you get 1 mark, and if it's beautiful, you will get 1.5 marks. Okay, so this is the tooth, this portion is the tooth, right? And then the gingiva. So marginal gingiva is that part of the tooth which is free. It is the free gingiva. It is the unattached gingiva, right? It is not attached to the tooth, right? It surrounds the tooth in a collar like fashion. This again, these words are from Kerenza. That surrounds the tooth in a collar like fashion. This t-shirt collar, like this is your marginal gingiva. You can see it is free. It is not attached, right? But it is covering the neck. Okay, so it surrounds the tooth in a collar like fashion. If I try to draw this, that illustration, this is the tooth and this is the marginal gingiva from here till here, right? This is the portion of the marginal gingiva, right? Now, guys, it is free, it is unattached, it surrounds the tooth in a collar like fashion. Then I must enlarge it. Is this diagram clear to you? Are you able to see it properly? Are you able to see it or not? Like whatever is written, are you able to read it or not? You tell me. Or you want me to enlarge it? It's clear. Good. Please make it a bit bigger. You see, that is democracy. And I like it. Is it better now? It must be better now, right? So marginal gingiva we are discussing. It is the free or now let's see there are 5 or 6 points in marginal gingiva. You must not forget. Marginal gingiva, as the name says, it is the margin. It is free or it is unattached. These words are important. Okay. From here to here is your marginal gingiva. This much portion. All right. This is your marginal gingiva. This portion. Right. And it is demarcated from attached gingiva by free gingival groove. This free gingival groove is also known as marginal groove, right? You see this point, this point. Below this is your attached gingiva. This hole is your attached gingiva. So the marginal gingiva is demarcated from attached gingiva by free gingival groove or marginal groove, right? Width of marginal gingiva is 1 mm, right? The width of the marginal gingiva is 1 mm. And very important point, I write a star whenever that point is important. Now this width of 1 mm, this free gingival groove, these are the questions which are asked in Viva and which are asked in NEET also, right? They are the simplest of questions if you talk about the NEET exam, right? But in your Viva, if you tell them, the examiner gets impressed. Okay, so the level of the difficulty increases. The same question can be easy or difficult depending on where it is asked, right? Now, the free gingiva or the marginal gingiva. If I say free gingiva, it means marginal gingiva. All right, do not get confused. This free or marginal gingiva, it marks or it makes the lining of gingival sulcus. What is gingival sulcus? I will tell you. I will just tell you, right? So this gingiva also marks the soft tissue lining of gingival sulcus. All right. Now I will insert one more picture, which is you must know that is called as gingival zenith. All right. What is gingival zenith? You must know what is gingival zenith. Now you see, guys, I will draw along this. This is the margin of the gingiva. Okay. These are the margins of the gingiva. So what is gingival zenith? Gingival zenith is the most apical point on marginal gingival scallop, right? Most apical point. If in the mandibular, this is it, like this. This is the marginal gingiva. So this point where it goes apically, this point, this point, this point, this is the gingival zenith. Okay, so gingival zenith is the most apical point on the marginal gingival scallop. Whenever you people give artificial crowns, FPDs, and especially in the maxillary central incisors, you want them at the same level. So when you do crown preparation, you see that gingiva must come at the same level. The zenith must be at the same level. Otherwise, one crown will feels bigger, other crowns feels smaller. Guys, is each and every point clear to you? Since it is the first class, it is a you can call it a demo sort of class. I am going very slow. This is not my usual speed. First day we are trying to build a relationship. trying to know how we are going to go about it. So I hope this is all you are understanding whatever I'm telling you. So this is the most apical point on the marginal gingival scallop, gingival zenith, and its dimensions, right? Its dimensions are important of marginal gingival scallop. Guys, wherever I tell you values, like what is the width of marginal gingiva, it is 1 mm. That is very important. Dimensions of this are important again. I have a daughter, like 5-year-old daughter. So whenever I take class, every Monday she comes once in my class. She came. That's why I went. Yeah, I mean, I wasn't audible because I had to just send her out. She was asking me, sir, Papa, how long? You don't teach me, you teach someone else. Okay, I hope now I must be audible. Yes, sir. Okay, ma'am. Right? So dimensions of gingival zenith, they are 0.06 to 0.96 mm. Right? No issues, man. Spelling mistake, just, I mean, the communication must be like, I understood what you were telling me, right? In exam, spellings are important. It was because of my daughter. Every class she comes, and whenever she doesn't come, I feel like, is she okay or not, or whether she is angry with me, that's why she hasn't come. You people must be thinking, hey, we ourselves are just daughters and son. Why, sir, he is very old. Why is he talking about daughter and all? Okay, now dimensions are 0.06 to 0.96 mm of gingival zenith. Now, in the marginal gingiva, what points you have studied till now? It is free or unattached, right? Its width is 1 mm. It marks the soft tissue lining of gingival sulcus and is separated from the attached gingiva by free gingival groove or marginal groove. Now, what is gingival sulcus? Okay, sir, when do we calculate this dimension from? Very good. Thank you. You asked a question, sir. Where do we calculate this dimension from? These dimensions are like in the mesiodistal direction and apicocoronal direction. Okay. So this is like mesiodistally. This is mesiodistal and this is apicocoronal. These are the two directions in which we study. Okay, so this basically is just a point. Like if this tooth, its zenith is here. Okay, now it depends on how broad is the tooth. So when the tooth is broad, its zenith will have a bigger dimension. Like you see, the maximum dimension could be like 1 mm, and that is very, very small if you see. So only in the microscope you can visualize that, yes, this is going at this particular point, right? So we calculate at that point only. The width of the marginal gingiva is 1 mm. So within that 1 mm, that particular point, you got it? And gingiva follows the contour. This line is very important what I'm saying. The gingiva follows the contour of alveolar bone. Okay? It follows the contour of alveolar bone. So if like bone is scalloping, so then it goes thick and thin it goes. And people have like thick gingiva, thin gingiva, medium gingiva. We call it as biotype. Okay, that gingiva, someone has a thin biotype, someone has a thick biotype. So in thick biotype, it will be towards the higher side. Did you get it or not? Did you understood or not about the dimensions of sulcus? How do we calculate? Now, what is gingival sulcus? Gingival sulcus, where is, sir, couldn't understand, where did 0.6 mm value is calculated? No. Uh, I'm telling you the dimension. You see, the whole gingiva. I'm drawing, like you see, this is a tooth. Biotype again, yes, good. Okay, so this is like I have tried to draw the centrals. Okay, I mean these are the teeth, and my handwriting is poor, so better to make you understand on the this itself. There it will be easier for you. Now understand. This I'm drawing. What am I drawing here? This marginal gingiva, right? This is the marginal gingiva. Now this marginal gingiva is till here, right? And here is the attached gingiva above this. Okay, above that is the alveolar mucosa. So this is the marginal gingiva, this hole around the tooth. So what it is saying, that the marginal gingiva, when around the tooth it is going from here till here till here, its width will not be uniform throughout. At some points it will be thicker, at some points it will be thinner, and it depends on the level of the bone, the scalloping of the alveolar bone. Alveolar bone is not flat, it is scalloped. It has elevations, it has depression, because alveolar bone is constantly remodeling. Okay, it is not flat structure. So gingiva follows the bone. Okay, so when it is going from around one tooth and on a particular tooth, like this is your tooth, so this particular point is the gingival zenith. Okay, now at this particular point, if you enlarge it and you try to see it within a microscope, if it becomes like this much, it is this point, gingival zenith. Okay, so it will have this dimension, which is like mesial to distal, and this will have this dimension, okay, which is apex and coronal, like this. Okay, so that dimension could be as small as 0.06. This is the minimum value, and this 0.96. This is the maximum value. Okay, biotype means type of gingiva, right? Like people have hair, the different hair type are different. Someone has thin hair, thick hair, curly hair, like that. No, so similar way, I mean, do not equate with that. I'm just trying to tell, right? So similarly, the gingiva, few people have very, like the gingiva on it gets like you eat hot tea or coffee and the palate it burns, and few people it doesn't burn because their gingiva is thicker, the palatal gingiva is thicker. And I'm not talking about palatal gingiva. The biotype refers to the facial gingiva. Okay, so that gingiva could be thick in some people, it is thin in some people. Now understood? Where did 0.06 value is calculated? It is calculated at this particular point. At this particular point, we are calculating this value. And biotype, did you understand? Now, what is gingival sulcus? I'm coming back and I'm liking this. This should be maintained every Monday in every class. You people asking me questions, and till the time it is not clear, you ask me again. Okay, so gingival sulcus, it is a V-shaped space around the tooth, okay, which has tooth on one side and gingiva on the other side, right? So this is gingival sulcus. This is your tooth and this is your gingiva, right? So this particular space, okay, this V-shaped space is your gingival sulcus, right? This is the gingival sulcus. This is the tooth. So on one side there is tooth and on the other side the gingiva, right? And which gingiva it is? Your marginal gingiva, right? Now this gingival sulcus is very, very important because this sulcus is formed because of the marginal gingiva. Marginal gingiva is free. It is not attached to the tooth structure, right? There is a space between the marginal gingiva and the tooth structure, which means you can insert an instrument. Which instrument? You write on YouTube in the comments. Which instrument I'm talking about here? That you can insert that instrument in the sulcus like this. Which instrument it is? Yes. You write very quickly. That's why there is typing error. This typing error can cost you big time also, dog. Just be like easy when you type. Yes, this is the Williams probe or periodontal probe. We insert and we can know the depth of gingival sulcus is a very important clinical parameter in periodontics, right? Depth of gingival sulcus is a very important clinical parameter. Okay. Ideally, this is very, very important. This is asked in the exam also, in the viva also. Ideally, the depth should be 0. Ideally, the depth of the gingival sulcus should be 0. What does it mean? It means that although the marginal gingiva is not attached, but it is close to the tooth. It is so close that nothing enters into the sulcus, like food particles, like water, like bacteria, because if they enter, they will cause disease. So ideally, it should be 0, but it is not 0. Ideally, this is achievable only in germ-free environment, which means you keep someone in isolated chambers which does not have any environmental bacteria or like that, right? In isolation you can keep. So there only it is possible. Okay. Now, very important point. In clinically healthy gingival sulcus, what is the meaning of clinically healthy gingival sulcus? It means there could be bacteria inside, like in every mouth. When you eat food, when you talk to someone, when you drink, the bacteria will be there. Okay, and since it is free, they will go inside and the food particle will go inside. But whether you have any disease, that is important, or you do not have any disease. So people who do not have any disease, they are called as clinically healthy. Okay, so in a clinically healthy gingival sulcus, what should be the depth? The depth should be 2 to 3 mm. Okay, in clinically healthy gingival sulcus, depth should be 2 to 3 mm. This is very, very important. This you must know, because if it is greater than 3 mm, if it is greater than 3 mm, it means there is infection in the gingiva, which is means like there will be probing depth is okay. If it is more than 3 mm, then it is a problem, like 2 to 3 mm. In a clinically healthy gingival sulcus, the depth should be 2 to 3 mm. Now there is also histological depth of gingival sulcus. Okay, the histological depth of gingival sulcus. Now, what do we mean by the histological depth of gingival sulcus? Histological depth of gingival sulcus means like this clinical depth, it will increase or decrease on the basis of like whether it is healthy. Like when it is diseased, it will become more because gingiva will increase in size. Okay, when there is disease, it will increase in size. So it will be like more than 4 or 5 mm. But when it comes back to health, gingiva will shrink. It will again will be 2 to 3 mm. But that histological depth, it depends on the attachment of the gingiva. And for an individual, it will remain constant. Like for every individual, the histological depth will be different. But generally, what is the value of histological depth of gingival sulcus? It is 1.8 mm, right? So that is the, and it has variations from 0 to 6 mm. Like this is the range, but generally it is 1.8 mm, right? So now you have 3 depths which you must remember. The ideal depth of gingival sulcus, 0 mm. The probing depth of a clinically healthy gingival sulcus, 2 to 3 mm. Histological depth of gingival sulcus, 1.8 mm. Okay, in histological sections, when you take the depth, it comes 1.8 mm, right? Like from the margin to the point where gingiva is attached. Like this is the tooth. At some point it will be attached, right? At some point it will be attached. So that in histology, it comes at 1.8 mm. Now, if the attachment shifts apically, that recession, then in that case, it can differ, but that is called as the true depth of the gingival sulcus, the histological depth of the gingival sulcus. All right. So these 3 depths you must remember. And when we are probing with a gingival sulcus with a probe, this point is important, people. What we look at the apical termination of probe. Okay. Sorry. To the distance the probe goes, that is important, right? We do not put it forcefully. The patient must not, or the individual must not have pain because of our probing. If the gingiva is diseased, as soon as you put your probe, the patient will have discomfort. Okay, but because of your probing, there should not be any pain. You must not cause any trauma to the gingiva with your probing. So you have to be gentle. Okay, that 0.75 Newton is the probing force. When it comes to that, I will be telling you. But when you are probing, the apical termination of probe, where the probe tip ends, that is important, right? So this was about marginal gingiva and gingival sulcus. Usually I take just 10 minutes in marginal gingiva and gingival sulcus. Since it is a first class, it is a get to know class. That's why I'm taking. Now next is attached gingiva. I hope gingival sulcus was clear to all of you. I hope you people reply whether the gingival sulcus and the marginal gingiva was clear to you. Okay. Now attached gingiva. Understood. Good. Again, I will draw. This is the tooth, and this is how our gingiva is going, like this, right? So till this point is the marginal gingiva, and here is the bone inside. There is the bone, right? So from this point till, and from this particular point below is alveolar mucosa. So this is your attached gingiva. Okay. I will tell you the dimensions and all, but first, attached gingiva. Free gingiva was the marginal gingiva. Here the name is attached. It is continuous. There is no like discontinuity. If you feel with the finger or anything, the marginal gingiva is continuous into the attached gingiva. So it is continuous with marginal gingiva. Now I will write marginal gingiva as MG. Right. Now very important point. It is firm. It is resilient. These words are important. These are like, you can say also technical terms. Attached gingiva, when it is healthy, it is firm and resilient and tightly bound to the periodontium. Okay? Or Saivin. Why I'm saying periodontium? Periosteum. Right? It is firm, resilient, and tightly bound to the periosteum. What is periosteum? Periosteum is the covering of the bone. Okay? And gingiva covers the bone and the roots, right? So attached gingiva, it is firm, resilient, and tightly bound to the periosteum. Its coronal dimension or its coronal point is this FGG. What is FGG? It is the free gingival groove or the marginal gingiva groove. Where does it terminate, or what is the end point of the attached gingiva? That is this point, and that is called as MGJ or mucogingival junction. Okay, so mucogingival junction is the point. It is the mucogingival junction is the point of demarcation between attached gingiva and alveolar mucosa. All right. Free gingival groove or the marginal groove is the point of demarcation between the marginal gingiva and the attached gingiva, while mucogingival junction is the point of demarcation between the attached gingiva and the alveolar mucosa. A very important point, the position of mucogingival junction remains stationary throughout life. It doesn't change. Okay, right? The position of mucogingival junction remains stationary throughout life. This is a very, very important point. I will insert a picture here so that you understand this point. See this. Can you see this picture? People, can you see this picture? Reply in affirmative if you can see this picture. Right. You can see like this is the marginal gingiva. This point, right? You see in this point. Okay. This is alveolar mucosa. All right. This is the marginal gingiva, this much. and this below is hole is your attached gingiva. This hole is your attached gingiva. Okay, so the demarcation, like in 50% of individuals, Kerenza says in 50% of individuals, when you stretch, you can see the demarcation between the attached gingiva and the alveolar mucosa. All right. Very important question which is asked is width of attached gingiva. Now I'm writing attached gingiva as AG. Okay. Width of attached gingiva is a very important question and it is asked a lot in your viva. And whenever you are writing an answer on gingiva, that answer will be incomplete if you do not write dimensions of gingival sulcus like depth of sulcus and width of marginal gingiva and width of attached gingiva. They are important. So width of attached gingiva, it is the distance between mucogingival junction and projection on external surface of the bottom of gingival sulcus, right? The definition is like this point comes when someone said he doesn't want, you people do not want to memorize. No need to memorize. We should not. I'll tell you how do we calculate this width of attached gingiva. I told you that the termination of attached gingiva is at the mucogingival junction. All right. I'll again put that image. Okay. So this hole is the gingiva. This is the mucogingival junction. What I said, it is the distance between mucogingival junction and projection on the external surface of the bottom of gingival sulcus. Now this is your gingival sulcus, this particular point, right? And it says it is the distance between mucogingival junction and projection on the external surface of the bottom of gingival sulcus. For a second, you just delete external surface from your mind. Okay. When you are writing in the answer, you can write. Okay. You have to write, you will get better marks. It says projection on the external surface of the bottom of gingival sulcus, because the bottom of gingival sulcus is where it is attached. And from there, your free gingival groove starts. So this will correspond. Okay. So like this, it is. Right? So this hole will be the width of attached gingiva. It is the projection on the external surface of the bottom of gingival sulcus. What is the bottom of gingival sulcus? Where your probe ends. Okay, where your probe ends. Your probe goes inside the gingiva, but the width of attached gingiva is calculated externally. So it is the projection on the external surface of the bottom of the gingival sulcus. Okay, when you are inserting a probe in this, like this way, you have inserted. So where the external projection comes, so that point they are saying. All right. So that is the width of the attached gingiva. Okay. Now I have already told you that the position of mucogingival junction, it remains stationary throughout life. Okay. But the width of attached gingiva can change in life. So that width will change only when anything happens in the coronal portion of the gingiva. I hope you understand this point. The position of mucogingival junction remains stationary throughout life. That is a fact that you must know. Okay. It will not shift with life, with time. Okay. So whatever changes occur in the width of attached gingiva, they occur because what happens at the coronal portion, like the gingiva can increase in size, it can decrease in size, there can be recession. So the attachment of the gingiva will, we will understand in the later part of the syllabus what is that attachment of the gingiva that I'm talking about. I'll tell you. But for now, you can know that this is the attached gingiva and its width. Okay, so that is the width of the attached gingiva, right? A point which is written in your book is that the width of attached gingiva increases in supra-erupted teeth. Okay, I will explain this point when we come to that, when we discuss the chapter on mucogingival surgeries and gingival recession. At that point, and flap surgeries, there I will tell you, okay, about supra-erupted teeth, what happens in gingival recession and all. Right now, you can just, like whenever you are writing an answer on attached gingiva, you have to write this point, that width of attached gingiva increases in supra-erupted teeth and by the age of 4 years. Okay, by the age of 4 years, right? So that is about the width of attached gingiva. Now, what could be the maximum width of attached gingiva and what could be the minimum width of attached gingiva? Which means, and now you see, attached gingiva's dimensions are very important. Attached gingiva should be as wide as possible, because wide attached gingiva means you have a good sulcus. This sulcus, buccal sulcus, facial sulcus. Like at times you have to place denture. So you must have proper width of attached gingiva so that the sulcus is proper. Otherwise the denture will lift up. Okay, I do not know whether you have had your perio postings, prosto postings or not. But width of attached gingiva is important there. So what is the maximum width of attached gingiva and what is the minimum width of attached gingiva? Maximum width is found in maxillary incisors. Okay, and that is 3.5 to 4.5 mm. Okay, in mandibular incisors also it is high. In mandibular incisors it is 3.3 to 3.9 mm, right? Now where is the minimum width of attached gingiva? Minimum width of attached gingiva is in premolars. Okay, it is in premolars, especially the first premolar. In maxilla, in maxillary first premolar, it is 1.9 mm, and in mandibular first premolar, it is 1.8 mm. Okay, maximum width of attached gingiva, minimum width of attached gingiva. These are the questions in Viva you must tell. If there is a question on gingiva, long answer question. If there is a short question on attached gingiva, you must not write. I mean, you must write these. You must not forget to write these. They are the basic things. Okay. This you have to write. So this was all about attached gingiva. It is continuous with the marginal gingiva. It is firm and resilient and tightly bound to the periodontium. Number 2 point, right? It is demarcated from alveolar mucosa by mucogingival junction. Number 3 point. Width of attached gingiva. Number 4 point. Width of attached gingiva increases in supraeruption and by the age of 4 years. Number 5 point. Okay. And maximum minimum width. Number 6 point. These points you have to write. Clear everything about attached gingiva? Is there anything that you want to ask? Because I'm writing the next part, which is interdental papilla or interdental gingiva, the last part of the anatomical differentiation of the gingiva. Understood. Great. Sir, what do you mean by the age of 4 years? When you go by the age of 4 years and subsequently the width of attached gingiva increases and then it reaches a constant value. That I meant. By the age of 4 years. That is when the attached gingiva is developing. When the gingiva is developing. That is what we meant by the age of 4 years. When someone reaches age of 4 years. Clear? Okay. Now, interdental papilla or interdental gingiva. It is that portion of the gingiva that occupies gingival embrasure. Okay. It is that portion of the gingiva which occupies gingival embrasure. As simple as that. What is gingival embrasure? What is gingival embrasure? The space between two teeth. Okay. What is gingival embrasure? Space between two teeth or space between adjacent teeth. Right? That is your gingival embrasure. Now this interdental gingiva, IDG or IDP, interdental papilla, it can be pyramidal in shape or it could be cone shaped, right? On this cone, on this pyramid, questions are asked. Right now I will insert the images or the illustrations of these gingiva. Okay, you must be able to see this clearly. This is your interdental papilla. Now this is the pyramidal type. Okay, and this is the cone type. This one, you see, pyramidal type, proper. There is no recession, there is no spacing, healthy gingiva. And this cone where there is demarcation, spacing between the teeth. So the papilla is lost. At that point, it will be depressed. That's why it is called as cone. Now, the shape of interdental papilla depends on what are the points on which the shape of interdental papilla will depend. Okay, there are 3 points: presence or absence of a contact point. All right, presence or absence of a contact point. Here you can see there is a tight contact, so it is pyramidal. There is no contact at all, so there is no pyramidal shape. There is a cone shape. There is different depression. Number 2 point. Number 2 point is the distance between contact point and osseous crest or the bony crest, right? This is the contact point. Okay, and if you see, like I told you already, gingiva follows the bone. If there is bone loss, then there will be space. There will be what we call it a black triangle sort of thing. Okay. If there is bone loss, then there will be that black triangle sort of thing, right? Like this, I'll show you. I'll try to draw. This is one tooth and this is another tooth. So if the bone is here, so the gingiva will be here. So this will be an empty space, this area. Okay, it will not be like this. You can say like if the gingiva ends here, so this gingiva will not be there. Okay, so the distance between contact point and osseous crest is important. And the last point, presence or absence of recession. Okay, so if there is recession, there will not be pyramidal shape. If there is recession, there the gingiva will be flat in the interdental area. Okay, so what is interdental gingiva or interdental papilla? And it is very important because in maxillary anteriors, the shape of the interdental papilla define your aesthetics. How do you look when you smile? Okay, so that is important. And also from functional point of view, if there is recession between the teeth, it will lead to food accumulation, which will lead to either caries or plaque development. Okay, so this is how The shape of interdental papilla is determined by presence or absence of contact points, the distance between the contact point and the osseous crest, and the presence or absence of recession, right? About Cole, one thing is asked. Okay, about Cole, one thing is asked, and it is said that Cole is the area of gingiva which is very prone to inflammation. Okay, this is a fact that Cole is prone to inflammation. Why? Because it is covered by non-keratinized epithelium. Okay, non-keratinized epithelium is the thinnest type of epithelium, the least protective type of epithelium. Okay, fine. So Cole is a valley-like depression area, right? This Cole is a valley-like depression. Okay, between two teeth, there is no contact between the teeth. So the interdental gingiva is flat. And when there is a proper contact without any recession, without any bone loss, then the interdental gingiva will be pyramidal or triangular shape. Okay, so this is about the interdental gingiva that you have to write. Clear every point about this? So then flat shaped or Cole shaped is the same thing. You can say same thing. I will not say technically it is the same thing. Okay. But yes, Cole is depressed. It is not actually flat. It is a bit depressed portion of the interdental gingiva, a bit depressed. Okay. But yes, more or less it is the same thing. Technically there is a difference. Cole is a bit depressed portion of the gingiva. Okay, like this is that your Cole. It is not flat, it is a bit depressed. So food can also accumulate over here. Like your spoon, it has that depression like the one which is there in a spoon. Clear? Right. So guys, this is where I will like to end our first day's theory. Why? Because this is just a first day. Very less we have studied. I guess we have a lot of time. In the next class, we will go a bit faster, then a bit more fast. But I promise you one thing. I will not go ahead from one point to the second if any one of you says not understood, sir. When the point has been understood by each one of you, then only I will proceed. Because my aim is not to finish the course, is to make you understand periodontics. Okay. Now guys, did you like what all did you understood? This was very, very less, 2 or 3 pages of Carenza this was. Okay. But did you like it? The way we approached it? Yes, we will not be taking this much time in your next class. In next class, we will finish gingiva and PDL also. But did you like this? The way we went about it? Because my speed will be faster in the next classes. But this is how I will make you understand. I will ask you again and again whether you understood or not. And I will not just keep on, good evening, this, good night, go. No, it will not be like this. We will take breaks. If even you people say, sir, even if you say after 10 minutes, sir, we want a break, I'll give you a break. Because that doesn't matter. Or if you say, no, sir, I didn't understand. Someone says, no, sir, I didn't understand. Explain again. I'm ready to explain it to you 10 times. The same point. Again, yes, sir, I have short-term memory loss. I forgot. what I asked you. So some more pictures, please. So see, this was the picture which was important for interdental papilla that I showed you. The picture which was important for attached gingiva that I showed you, and for marginal gingiva also. So whenever pictures are necessary, I'll put. I have all the pictures with me. Okay, guys. So I am like tonight. This is the end of tonight's lecture, our first lecture, our inaugural lecture, where we wanted to know each other. And I have a good feeling about you people, your batch. You are interactive, you're responsive, you don't shy, you don't shy away from asking questions, from saying you didn't understand, which is a promising thing, which means like this is Feb end. When May or June comes, you guys will be thorough with periodontics. All right. Okay, guys. So this is where I say good night. Take care of your health, of your loved ones. Study well. Be a good guy. All right. Good night, people. I'm switching off the feed. Sir, how to write and think fast during exams? A very good question. You must, like, this all depends on how you prepare. You must know, you prepare answer keys. Like I told you, no, in attached gingiva, there are 5-6 points which are important. So you must know. You people, you would have groups of your friends, 3 or 4 people. You keep on asking with each other, like in this question, what all points you will write. So as soon as in your exam hall, you see a question, you must have your answer ready. And you write a key to your answer. Of course, of a long answer questions. So these will be the headings. Then these will be the subheadings. So like that, you have to break a question. Okay, that can help you in write fast and think fast, because in your head it should be there, then only your hand will move in flow. Because if you are thinking while you are writing, then it will slow down your speed. Okay, so that is about practice. That is about when you have understood the points. Okay, so like from next class onwards, this also people do, you will ask me questions. Sir, in this question, what all we will write? So I'll tell you, this is all you will write, so that you will have an idea. So it will help you in writing and thinking fast during the exam. Okay, so we'll meet on next Monday. Take care of yourself. Good night, guys.